G'day mate, 40 here. So many interesting stories in the news that I just want to hit. So number one, the porn site OnlyFans has now banned porn. So I find it interesting that the news business and the porn business both declined at the same time. So the news business, it never really was able to make a living based on news. All right. So the news business depended upon dominating classifieds and certain forms of advertising and wrapping just a whole bunch of diverse forms of information around the advertising. So that's what created the news business as a business. And then porn, it was destroyed by the rise of all the free tube sites. So people could get everything they wanted just from going online. They no longer had to pay for anything. So news as a business and pornography as a business are essentially destroyed. And now OnlyFans has banned porn, which is kind of weird because it's a porn website. So why is OnlyFans ban porn? Well, it has a lot of applications to the dissident right. So your ability to monetize your content as a dissident right video creator largely depends upon the approval of credit card companies. And credit card companies don't want to be associated with the porn industry. So why have credit card companies suddenly taken a dramatic adverse reaction to the pornography industry? It's because of an article in the New York Times by Nicholas Kristof pointing out how much underage pornography was flowing through the porn tube sites and how much rape and illegal pornography was just flowing through the tube sites, that there was a lack of basic authentication and documentation of age and identity verification, making sure that everybody consented to the content, because there was a lot of content that was being uploaded to the tube sites featuring people who had not consented. And Nicholas Kristof presented this in the most dramatic ways possible. And just by doing that, the Children of Pornhub, all right, these two articles, why do we let corporations profit from rape videos? And then the Children of Pornhub, right? So the Children of Pornhub came out December 4 of 2020. This is why credit card companies don't want to be associated with with pornography. Like, why do we let corporations profit from rape videos? All right. So as soon as you have the prestige media, like the New York Times, coming out with articles like this, then credit card companies and big corporations are going to want to have nothing to do with this kind of behavior. So too with many people on the distant right. They are able to flourish for a while until the prestige news media got a hold of them, dug through their content. This is what's happening to Larry Elder now. He's running for governor of California, and he has an ex-fiance who's come out and said that when he was high on marijuana, he pointed a gun at her. So the prestige media posts an explosive story like, why do we let companies profit from rape videos? And then suddenly credit card companies say, we want nothing to do with this. So they've essentially throttled the pornography industry online. And so you have a porn website like OnlyFans, which is now banning porn. And Times of London points out that, the BBC points out that there's been a whole bunch of significant failures in OnlyFans platform moderation. So OnlyFans was allowing all sorts of illegal behavior. Minors were illegally selling and appearing in sexually explicit videos on OnlyFans. There were videos of sexual trafficking and exploitation. There were prostitution services, advertisers, bestiality, incest. All right, this was pouring across OnlyFans, and so credit card companies want nothing to do with that. So just like the alt-right was considered just a bunch of merry pranksters until Charlottesville. And after Charlottesville, the prestige media got a hold of the alternative right and dug up stuff that looks really awful to your average person. And then payment processors like credit card companies and PayPal just like, no, we can't have anything to do with the alt-right or anyone saying anything alt-right adjacent. We just have to shut it down. So it seems to me what's going on with OnlyFans right now and the considerable restriction of the content that they're going to be able to monetize has just shrunk like this. So the internet is no longer the wild west. I mean, I should know, I was one of the earliest bloggers. So I was blogging for a living starting in about 1997. I eventually got sued about 5 times for libel. So the wild west days of the internet are behind us. Society will be increasingly bureaucratized and regulated, and you're not going to be able to get away with the type of expression that we were able to get away with in the past. So, and this is inevitable. Absolutely inevitable. I don't think there's any way around it. Okay, there's an article in the New York Times that you COVID skeptics, vaccine skeptics are going to love, and I am a big believer in vaccines for COVID, but this article has things that that everyone can love, right? You're a skeptic, you can love this article. I'm a believer in vaccines. I can appreciate this article. So Israel was considered the model for beating COVID, and now it faces this whole new surge of infections. So Israel is one of the most vaccinated societies in the world, and it now has one of the highest infection rates in the world, which the New York Times says raises questions about the vaccine's efficacy. Now, I don't think that's fair, YouTube. I don't think the New York Times presentation of this is fair, because generally speaking, those who are getting hospitalized and dying in Israel are not fully vaccinated. But let's go back to the spring. So last spring, we had Israel's swift vaccination campaign. It was seen as a global model. Coronavirus infections plummeted. An electronic pass allowed the vaccinated to attend indoor concerts, sporting events, distancing rules, social distancing rules, mask mandates were eliminated. So Israel seemed to offer the world a hopeful glimpse of the way out of the pandemic. Well, no longer. So now we have a 4th wave of infections approaching the levels of Israel's worst days of the pandemic last winter. So the daily rate of confirmed new virus cases has more than doubled. So vaccines, remember, they provide internal immunity against the most severe consequences of the COVID virus, but they don't provide mucosal immunity. So you can still get the virus, you may be symptom-free or have relatively low-level symptoms like the sniffles. But generally speaking, you take the vaccine, you're not going to end up in hospitals. So, but Israel, one of the world's most vaccinated societies, has reinstated restrictions on public gatherings, commercial and entertainment venues, and the government is considering a new lockdown. So how did Israel's pandemic response shift from shining example to cautionary tale? Because Israel's new prime minister, Naftali Bennett, he staked a claim for leadership in part on his manifesto, How to Beat a Pandemic. So there are some experts, according to the New York Times, who fear that Israel's high rate of infections among early vaccine recipients may indicate a waning of the vaccine's protections over time, which is a finding that contributed to a U.S. decision Wednesday to begin offering booster shots to Americans starting next month. So about 8 months after you got vaccinated, you're going to be able to get booster shots. So terrific article here in the New York Times. I'll post a link in the video description. So I think the Alex Berensons of the world will appreciate this article. So Israel was supposed to be the role model, not so much. So the vaccine seems to be less effective at preventing infection with the highly contagious Delta variant, says the New York Times. This is not me. Now, the Delta variant is the primary version of the virus in Israel. And the first cohort to be vaccinated in Israel was an older group whose immune systems may have been weaker to begin with. Now, in June, Israelis were convinced that the worst of the pandemic was over. Americans thought the same thing, and they abandoned social distancing and other precautions, and everyone just wanted to put the previous year and a half behind them. So the paradigm in June was Israel's the most vaccinated country in the world. Vaccinated people rarely become infected. Even more rarely do they become severely ill. And then with just a few precautions in place, the population is now very close to herd immunity. And that was a perception in June. Now, that was true for the original virus, but it does not necessarily hold true for future variants coupled with waning immunity. So the vast majority of Israel's older population received 2 doses of the Pfizer vaccine by the end of February. So 78% of the Israeli population 12 and older are fully vaccinated. Now, the vaccine still believed to prevent severe illness in those who become infected, but some Israeli data suggest the possibility of an increased risk of severe disease among those who received early vaccinations. So the number of COVID-related deaths in Israel has climbed in the past month as the infection rate has increased. So the Delta variant has taken over in Israel. And there are about 1 million eligible Israelis who have opted not to get vaccinated. And there's growing evidence of waning immunity from the vaccines, particularly among the elderly who are vaccinated first. So according to Israel's Ministry of Health in late July, the Pfizer shot was just 39% effective against preventing infection, compared with 95% from January to early April. But in both periods, the vaccine was more than 90% effective in preventing severe disease. So there were many days of 0 COVID deaths in Israel in June, but in August, at least 230 Israelis have died of COVID. And this is not primarily happening among Israel's crowded, less vaccinated, ultra-Orthodox communities. Yes, Robert, I think you did mention these stats. So Israel is now in a 4th significant wave of COVID. And Israelis are still in routine mode. They feel that, look, we're vaccinated. It's hard to make the switch in public discourse to say, listen, we're in a catastrophe. Yeah, it just means you need to take the booster shot twice a year now, forever. Yeah, the ultra-Orthodox, also the Haredim, have a younger demographic profile. So Israel is now pinning its hopes on booster shots. So Israeli researchers say there's preliminary signs that new infections among older vaccinated people have begun to drop. A booster shot of the Pfizer vaccine apparently provides 86% effectiveness against infection in people aged over 60 within a week of receiving the 3rd dose. Most Palestinians in the West Bank and Gaza remain unvaccinated. So Professor Davidovich, Israeli public health expert, he got a 3rd shot, a booster shot. He's convinced of the necessity of a multi-layered strategy, including mask wearing, limiting access to public venues to the vaccinated or those who've recovered from the virus, and strengthening the healthcare system. So the vaccinations were supposed to solve everything. We now understand that the vaccines are not enough. That's the discouraging word from Israel. So there's a new book out, DSM Review, The Meanings of Madness. So the book's called actually DSM, A History of Psychiatry's Bible. And it's by Alan V. Horwitz, and he is a sociologist of medicine. Probably didn't know that medicine had sociologists, but he seems quite intriguing. So book review in the Wall Street Journal this week on the DSM, the Diagnostic and Statistical Manual. So what is meant by mental illness? So if we have a mental illness crisis, that means more work for people like psychiatrists, right? So psychiatrists have a financial incentive for hyping a mental illness crisis. But does psychiatry deserve such authority? So the DSM is a social creation. It's not related to biological findings. It's not related to empirical scientific findings. It's a crowdsourced manual, right? Diagnostic and Statistical Manual. What does that stand for? DSM. Diagnostic and Statistical Manual of Mental Disorders. And second argument is we're stuck with it. So it's flawed, but that's what we've got. So it permeates American society. You hear the widespread casual use of terms like bipolar disorder, autism spectrum. These almost all psychiatric diagnoses are not based on blood tests, right? And if you take the same persons to different psychiatrists, they'll get different diagnoses. So there's very little objectivity to psychiatric diagnoses. So insurance companies now pay for mental health care, and so they need a standard to decide which disorders merit treatment reimbursement and which don't. So they use the DSM. So that's why we have DSM, not for patients' needs, but for insurance companies' needs. So formal diagnosis makes it easier for insurance companies to decide whether or not they're going to fund treatment. So drug companies haven't directly influenced the DSM's contents, but they have contributed to its popularization. So in the early 1970s, the Food and Drug Administration required pharmaceutical companies to stipulate which specific diagnoses their products treated. But remember, there's no objective test for these diagnoses. It's highly, highly subjective. So all these drug ads made household names out of DSM diagnoses. But more often than not, patients would give themselves these DSM diagnoses before setting foot in a psychiatrist's office. So the DSM's approach is vague. Right, there's not much scientific basis for the DSM or for psychiatry itself. The anti-psychiatry movement has not been adequately refuted. So psychiatrists essentially operating as referees, kind of mediating disputes over the nature of various mental disorders. But these mental disorders are at root all about financial incentives and changing social norms. They're not objective. So in the early 1970s, you had gay activists who lobbied to remove homosexuality from the DSM. So many psychiatrists said we need to frame homosexuality as a medical condition. That's better than framing it as a crime. So some renegades have argued that modern psychiatry is essentially a form of social control. Gay activists won that dispute. Veterans then lobbied for the inclusion of post-traumatic stress disorder, PTSD. Feminists demanded that the DSM expand its diagnoses to repressed trauma. Transgender activists have defended the inclusion of gender dysphoria so as to protect access to insurance reimbursement for sex change operations on the basis that they're needed for mental health. So psychiatric diagnoses is not really a science, much more of an art, except it's an art that is primarily driven by financial incentives. So the DSM claims that mental disorders are patterns of observable symptoms, which is how psychiatrists 200 years ago defined them. And the DSM says nothing about how these medical disorders developed. There's not much underlying science to DSM diagnoses or psychiatric diagnoses. So an unhealthy mental or behavioral pattern to qualify as a psychiatric disorder can't be, according to DSM, an expected reaction to adversity. So if you're heartbroken over being dumped, can't be a culturally expected practice, such as hearing voices in a religious ceremony, or a form of social deviance, such as criminality. So many DSM classifications do fall under these categories, therefore they are not legitimate mental disorders. So many quote-unquote mental disorders, DSM diagnoses, emerge from uncertainty, factionalism, intense political conflicts, economic considerations, and other interests. So this bloke has also written a terrific book, co-authored it, called Diagnosis, Therapy, and Evidence, Conundrums in American Medicine. So our quality of life and our length of life have actually very little to do with the medical care that we get. Let me scan through the chat. Worst case scenario for COVID, everyone catches this, all people die, social security costs drop. Tougher people will skate through. What happened to the official Luke Ford live stream show? It just seems like too much bother. It's just easier just to set up my phone and just talk to you about something that's on my mind, just something, more informal, just get in and get out. Not playing other videos. I'm just talking to you heart to heart, bro. Heart to heart. Yeah, we're stuck with the DSM. Some fraction of the population is going to develop schizophrenia. Not much we can do for them. Josh Randall says his serotonin levels are low. Well, just keep watching the stream, Josh, and you'll experience your serotonin level steadily rise. Yeah, you'll be fine, Josh. Once you go in, sit on the bike, do the elliptical, get the blood flowing, you'll feel better. Some mental illness might be nothing more than demonic possession, says Robert. Okay, this is a terrific book, Diagnosis, Therapy, and Evidence in Medicine. So Americans spend more on medical care than any other country in the world. We spend about $7,000 per person per year on medical care. And it has very little to do with either the quality of our life or the length of our life. So why are we spending $7,000 a year? Something that has very little. How many kippahs do I have? I don't know, a dozen. So Americans tend to believe that their healthcare system's the best in the world. Elliot Black, you're going to love that article on COVID-19 in Israel. Right? You're going to love that article that I referenced earlier, and it's linked in the video description. So Americans tend to believe they have the best healthcare system in the world. In many ways, that's true. Like most medical advancements are done in the United States. So Partybot says, I hope this is a temporary break and we get back to the ultra-high serotonin-inducing official Look Forward live stream. I know we have returned when I hear that glorious introduction music. Return to tradition, bro. Okay, so for most lifespans actually haven't changed that much in the past 10,000 years. So if you made it to age 30, 1,000 years ago, 2,000 years ago, 3,000 years ago, you're about as likely to hit age 60 or 70 as we are today. So the main difference in lifespan is that people have stopped dying in childbirth and in infancy. Right? That's where almost all advancements for life expectancy have come. So for most of human history, death was associated with infectious diseases that took their heaviest toll among infants and children. That's where the change came. Whoops. Okay, here we go. I'll throw down the link to this New York Times article. All right, it's not because we got this amazing medical care, right? most causes of death were among infants and children due to infectious diseases. But in the late 19th century, for reasons we don't fully understand, infectious diseases began to decline as the major causes of mortality. And so what happens then? So Mr. White Male thinks anti-aging tech will be revolutionary. It may be, it may not be. Right? Medical care has not really done much for either the quality of our life or the length of our life. Very minor. Yeah, plumbers and engineers have saved far, and garbage men have saved far more lives than doctors. So with this reduction in mortality among infants and children, this allowed more people to reach adulthood and live longer. So because of this, now long duration illnesses, notably cardiovascular-renal diseases, so heart diseases, and various neoplasms. So what the hell is a neoplasm? Neoplasm is an abnormal mass of tissue that forms when cells grow and divide more than they should. Okay, talking cancer, right? So heart disease and cancer, right? These are diseases associated with advancing age, right? Long duration illnesses have become more prominent because people are not dying young. So the longer people live, the greater the risk of becoming ill or dying from heart disease or cancer. So we've had this explosion in long duration and chronic disease because more and more people are enjoying greater longevity. Now, this decline in mortality from infectious disease, it preceded antibiotic drug therapy. But the introduction of antibiotic drug therapy after World War II reshaped medical practice and reshaped public perceptions. All right, so if infectious diseases could be conquered with antibiotic drugs, why could not long duration diseases such as cancer and heart disease also be eliminated by new medical therapies? So Americans have come to believe that the medical care system could play a crucial role in conquering disease and extending longevity, and not just length of life, but the quality of life. But underneath the surface that medical care is going to provide us with higher quality life, there's great unease because we're spending more than $7,000 a year, all right? So in 1970, we were spending $75 billion a year on healthcare. In 2006, it had risen to $2.1 trillion. So healthcare as a percentage of the gross domestic product rose from 7% to 16%. Per capita expenditures rose from $356 a year. That's what we were spending in 1970 per capita. $356 a year on healthcare. To 2006, we were spending $7,000 a year per capita. Public funding of health expenditures increased from 38% to 46% between 1970 and 2006. So we've got the increasing bureaucratization of the medical care industry, which has diminished trust between patient and physician. We have increasing concern that doctors are not acting in our best interests. So doctors, we have much less faith in doctors and public health authorities now than prior to the 1960s. So prior to the 1960s, we trusted our bodies. Whoa, party bots. Like a bridge over troubled water, I will lay me down. So party bots, you want the traditional show to return with the music and the fancy videos and the guests. Wow, thank you so much. So $7,000 a year, this is what we were spending in 2006. So it's probably like $9,000 a year per capita. Wow, thank you, party bots. I'll have to take that under prayerful consideration. Sat Nam to you. Right, so we have much more skepticism of doctors, hospitals, public health authorities since the 1960s. We see that insurance companies are shaping treatment protocols, and faith in all these new medical therapies is tempted by all these findings that question the efficacy of all these new medical treatments. So a whole bunch of widely used medical treatments, there's no evidence that they're effective. We also are increasingly distrustful of the pharmaceutical industry because we realize that the harmful side effects of many drugs have been hidden, that the efficacy of many widely used drugs is greatly, greatly exaggerated so that their real efficacy is only slightly above placebo level, if that. And we're concerned that the financial relationships between doctors, pharmaceutical companies, are prejudicing doctors so that they prescribe things that are not in our interest but are in the doctor's financial interests. And then we've got, all these enhanced suicidal tendencies from people going on psychiatric medication. So we've had a considerable diminishing of our trust in the medical profession. So the United States spends twice as much on healthcare compared to the median of industrialized nations. Obesity, smoking rates much higher in the United States than in 10 European nations. In terms of equity in healthcare, the United States ranks at the bottom among industrialized nations. Now, access to healthcare and how much you use healthcare has virtually nothing to do with your length or quality of life. So some parts of the country have much more access to healthcare than other parts, and there's no corresponding relationship between having healthcare and having a long and healthy life. Now, Americans were known as about the tallest people in the world between the middle of the 18th century to about the middle of the 20th century. Now, we are way behind many European nations, so that's just one indicator of our poor rates of health. I think part of that may have to do with dysgenic trends, another part may have to do with immigration of peoples who don't tend to grow particularly tall. And perhaps European welfare states with universal safety nets are able to provide a higher biological standard of living to their children and youth than the free market US economy. So there was a study that attempted to measure the quality of medical care in 12 cities in America. And it tried to determine the degree to which recommended medical care procedures led to longer and improved quality of life. And the results were terrible. So Americans, on average, receive about half the number of recommended medical care procedures. So the gap between what we know works and what is actually done is substantial. And it's not at all clear that prevailing standards of care are efficacious. So the evidence in support of many widely used therapies, such as drugs for decreased bone density, or statins for cholesterol reduction, or surgery for back pain, and various surgical procedures to treat CHD. What is CHD? So medical abbreviation mean congenital heart defects. All right, these widely used therapies, there's no evidence that they work. I mean, they work to increase physicians' income. Right? There's no evidence that statins work for your health. There's no evidence that surgery for back pain is generally effective. So when hospitals implemented American College of Cardiology guidelines for treating acute myocardial infarctions, it found that the adoption of such guidelines had no effect on outcomes. All right? So various medical doctors, like the American College of Cardiology, they have guidelines on how to treat certain things. When more hospitals adopt these guidelines, there's no benefit in health outcomes. Right, all sorts of technological innovations in healthcare that have come along in the last 40 years. For many of them, there's very little evidence that they actually benefit anyone. So computer tomography, CT, angiography, no evidence that it benefits. So Medicare wanted to stop funding it, but the Society of Cardiovascular Computer Tomography, so it's an organization of 4,700 doctors, the American College of Radiology and the American College of Cardiology launched a lobbying campaign that succeeded in forcing Medicare to keep paying for procedures that yield no benefit. All right? So many of the procedures that are given to us, recommended to us, and are paid for by Medicare, there's no benefit except to the doctors who get to line their pockets, who are effective lobbyists. There's no evidence that CT and MRI scans, right, for many conditions improve health outcomes. Right? Meniscal findings on knee MRIs have no clinical relevance. Arthroscopic surgery, generally speaking, provides no benefit. And then we've got dramatic regional differences in medical therapy and expenditures. So Medicare patients living in Rhode Island, they undergo knee replacements at a rate of 5 in 1,000 people. In Nebraska, the rate is double. So female Medicare enrollees who are diagnosed with breast cancer in South Dakota have 7 times the chance of undergoing a mastectomy as compared with Vermont, but the health outcomes are the same, right? So you have regions where there's dramatic amounts of health care and health expenditures and medical therapies extended, but life outcomes and health outcomes are unchanged. So the evidence suggests that differences in medical spending don't make much of a difference for health outcomes. So you've got some areas where you've got more hospitals, more doctors, more labs, more subspecialists in a given geographical area. So the more you've got of them, the more they are used, but there's no difference in health outcome. Yeah, superior diagnosis will help in some things, but most of what ails us will either go away on its own or it can't be fixed, right? So we've been propagandized that the American medical profession is always coming up with these new and innovative and important therapies, but most of what ails us either cannot be fixed or will go away on its own. So there are some regions that do vastly more hip and knee replacements for chronic arthritis and surgery and for lower back pain. But those regions that do a lot more surgery, hip replacements, knee replacements, there's no benefit in health outcomes. So about a quarter of adults report lower back pain, about 15% report neck pain. And between 1997 2005, there was a substantial increase in rates of imaging, injections, use of opiates, and surgery. Right? So total expenditures for these conditions increased 65%. Right? $86 billion was spent. Very little difference in health outcomes. There's no evidence that people with these conditions reported a corresponding improvement in their health status. So we had intervertebral fusion cages introduced in 1996. We had lumbar fusion rates accelerate, but no evidence that people are better off. We've had all sorts of discectomy, laminectomies as a result of these spinal fusions. So you get one back surgery, it tends to lead to another back surgery. So there are parts of the country with high rates of surgery and other parts of the country with low rates of surgery, all right, for the same surgeries, all right? But very little difference in health outcomes. Cesareans. So some parts of the country perform a lot of cesareans, other parts very few. There's no evidence for most cesareans that these are beneficial. But the doctors make money and the hospitals make money from them. Hysterectomies and oophorectomies. What's the health outcome? All right, you have a lower life expectancy if you undergo these procedures, and an awful lot of women report complete cessation of sex drive after these procedures. But doctors keep wanting to do them because doctors get to line their pockets. But health outcomes for patients, not so much. All right, we've got this rhetoric of medical science, right? It's overwhelmingly awesome, but we don't have evidence that this is true. We've got a proliferation of new diagnoses, but remember, doctors have financial incentives just like you or I. So if doctors, psychiatrists can tell us we've got a mental health crisis, they can come up with new syndromes like post-traumatic stress disorder, right? They can make money from that. So for many of these new diagnoses, there's very little attention paid to the nature and quality of supporting evidence, or for the methods employed to measure the validity of these new therapies. So we have widely used therapies and health recommendations that tend to be taken at face value by a receptive public who are completely unaware of the shaky foundation upon which they rest and upon the adverse consequences that follow from these innovative medical therapies. What about outcomes for sexual reassignment surgery? Not so awesome. Art Bell says, the ideal show would have Jean-Francois Garapi on 1X, one time a month, Warland on, Dennis Dale on, Red Bar, Ramsey Paul, Richard Spencer. Josh says, if I get a terminal diagnosis, I'm jumping into an active volcano. Screw the medical field. You're saying that magnets aren't going to fix my depression? So this is a fascinating book, Diagnosis, Therapy, and Evidence in Medicine. It's the same author who wrote the new book on the DSM. So the whole role of medicine has changed. So it used to be historically the role of medicine was to treat a sick person, but until 1930, you were better off not going to a doctor, generally speaking. All right? It wasn't until about 1930 the people who went to a doctor were better off than those who didn't go to a doctor. Right? So until about 1930, medical doctors did about as much harm, if not more harm, than good. So historically, we thought of doctors that we have doctors to treat the sick person. So before 1940, the major function of medicine was to diagnose disease. But the therapies that they had at their disposal prior to 1940 were hardly impressive. So with the exception of a very limited number of medications such as digoxin, D-I-G-O-X-I-N, thyroxine, insulin, immunization for a small number of infectious diseases, and a few surgical procedures, prior to 1940, doctors had few effective means of coping with many infections, heart diseases, cancer, and many long-duration illnesses. So useful medications for mental illnesses did not emerge until the 1950s with things like, what's that gold standard for evening you out? I'm blanking. I was on it. It makes you fat. I'm blanking. It came out of Australia. Yeah, Luke needs Ricola candies. Lithium. Lithium's the gold standard. Lithium is wonderful. All right. So doctors also weren't thinking about preventing disease. So health was simply the absence of disease, and the role of doctors prior to 1940 was simply to treat and care for the sick. But in the last half of the 20th century, we've had a dramatic perceptual transformation. So the World Health Organization promulgated in 1946 that health is a state of complete physical, mental, and social well-being. It's not merely the absence of disease. So prior to this, health was just considered to be the absence of disease. So this new definition created new roles for the medical profession and new ways for the medical profession to make money. So now the care and treatment of the sick is only a part of the doctor's responsibility. now the doctor had the added function of trying to make people healthy, happy, and socially well adjusted. So health was now considered normal. Physical, mental, social health was considered that which is normal, and sickness, disease, and distress are considered abnormal. And they are considered to result from a variety of external factors. It wasn't that it was internal to us to get sick. No, this was coming from the outside. So the role of medicine became to persuade people to engage in healthy behaviors and to avoid the consequences of inappropriate behaviors like unprotected backdoor sex that result in disease and death. So we now had medicine. It's got the knowledge to create a disease-free society. So treatment, care, cure, prevention were only part of the new face of medicine. We now had the claim that doctors, by employing the findings and insights of science, now have the power to improve on nature. We now have novel interventions to enhance brain functioning, to increase stature, to arrest aging, to increase longevity, to alleviate anxiety, to create desirable character traits, to maintain high levels of sexual activity, and to reshape our bodies, right? This is the new direction for medicine after 1946. So traditionally acceptable levels of blood pressure, cholesterol, glucose were revised sharply downward to increase the population who's at risk, and hence elevate the rationale for medical intervention for more and more of the population so doctors can make money and pharmaceutical companies can make money. So we had this coalition of scientists, doctors, pharmaceutical companies promoting a variety of interventions, including drugs and surgery, that would presumably enhance both the physical and the mental well-being of people, even those who were presumably healthy. So this naive belief that disease can be prevented and conquered and nature can be improved upon, it reflects this fundamental conviction that all things are possible. Yes, you can have it all. Right? You can live to 130 or more. Now, disease is the enemy of humanity. Only a war can vanquish it. Right? So descriptions of cancer are phrased in terms of war. Cancer cells do not simply multiply, they are invasive, they colonize, they metastasize. So we get medical treatment framed in military language. We've got a war on cancer. How's that war on cancer going? So chemotherapy is chemical warfare. And any healthy cells that are harmed or destroyed, that's simply collateral damage, bro. Right? The war on cancer, we must fight it to the finish. The only acceptable outcome is unconditional surrender. Mental health means we need to aggressively screen for untreated mental disorders in primary medical care, schools, and work. So we have this faith that disease is somehow unnatural, can be prevented and conquered, but this depends on a fundamental misunderstanding of the biological world. Right? If cancer is the enemy, then we are the enemy. Malignant cells are not aliens who invade our bodies. They arise from our own normal cells. The biological world of which we are part includes millions of microorganisms. Some are harmless, some are parasitic, some have the potential to cause infection. Others play vital symbiotic roles that nourish and maintain life. So some microorganisms contribute to soil fertility by converting plant debris into humus. Others destroy crops. Others cause disease in humans. But other microorganisms that reside in the gastrointestinal tract play constructive and vital roles. So efforts to destroy pathogenic microorganisms through drugs are doomed to failure because these organisms develop resistant properties. So have you ever thought about the dramatic conflicts of interest for doctors between helping an individual and helping society? So to help society, you would limit the number of drugs that you prescribe so that diseases don't become drug resistant. But to help the individual, you want to do everything you can. To help society, you would notify the DMV if an individual is at risk when they're driving. But to be on the side of your patient, you wouldn't notify the DMV. And with regard to mental health, we now regard these natural psychological emotions such as sadness and fear. They've now been diagnosed as mental illness. They're now depressive and anxiety disorders that psychotropic drugs can suppress. So threats to health are inescapable accompaniments to life. Right? Disease will change its manifestations according to social circumstances. Disease will be an omnipresent part of the human condition. You cannot get rid of it. The belief that disease can be prevented or conquered is a delusion. So, medicine cannot cure or even explain the basis of many long-duration illnesses that account for the bulk of mortality. So, the basis, the etiology of the major diseases of our age, such as heart disease, cancer, diabetes, mental illness, remain shrouded in mystery. These intractable diseases reflect an extremely complex mixture of nature and nurture set against the background of aging, which is modified by genes and environment. There are multiple causes, and there are probably many different routes to their pathology. So this belief that we can conquer disease and create a happy and well-adjusted society is nonsense. So we've got the medical profession, the pharmaceutical industry fueling this nonsense because they both benefit by promoting this pursuit of health. Medical profession because it strengthens its legitimacy, its authority, its claim on resources. Pharmaceutical industry because it enhances sales of its drugs. And the media, both visual and print, contributes to the faith in medical progress by providing breathless coverage of alleged therapeutic breakthroughs with very little evidence behind them, and all these super new ways of preventing disease. Now, the appearance of the AIDS epidemic contradicts belief that infectious diseases no longer pose a significant threat. The COVID pandemic contradicts belief that infectious diseases no longer pose a threat. Influenza remains a major threat. Why? Because the virus is constantly undergoing genetic reassortment. Now, normally the reassortment is between an animal and a human influenza virus, but sometimes there is direct transmission of an influenza virus from an animal or a bird species to humans, and the 1918 pandemic is just one example. So the 1918 Spanish flu pandemic killed as many as 20 to 40 million people. And microorganisms are continually developing new resistance to medication. And many medical therapies and drugs come with considerable risks. Anesthesia, surgery, sophisticated diagnostic procedures have the potential to cause devastating illness. So between 5 to 10% of the patients admitted to acute care hospitals acquire infections there. And this risk is increasing. So we have hundreds of thousands of people each year dying from medical malpractice. Let me scan through the chat. Ramsey Paul is getting edgier. Josh Randall's morning regimen: double espresso with cream, 1 melted modafinil, 3.5 grams of mushrooms, 3 huge hits off a PCP dipped Newport cigarette, 30 minutes of meditation and prayer. Ramsey Paul is edgy. He asks why the US and Canada must take in refugees from Afghanistan. He gets really hot about it. Yeah, look up how many people die from doctors not properly washing their hands. Way too many. Bye-bye.